Hi, Lisa Marie Kosis of Global One Health. In this video, I want to talk about another exercise that addresses mobility of the hip joint. So while it could fall in the category of the hip joint series, this exercise is actually part of the classical Pilates mat repertoire and is called the single leg circle. So the exercise is done supine position, which is on the back, and it can be done, classically it's done with no props, but you can also use a TheraBand, and I'll show you that variation after I show you the classic format. So I'm going to get it to my back. Now, the exercise is, as I said, single leg circle, so I'll just show you what it looks like first. I'm simply going to do a circular pattern with one leg, right? I'll show you a few in each direction, and then you would always go in both directions. So you're going to go clockwise and counterclockwise with each of the legs. Now, a couple important pointers. While the exercise is similar in the concept of hip cars, the controlled articular rotations that I talk about in some of my other videos, while you are moving in the transverse plane, you're not getting extension because you're in that supine position on the ground. So you're really just getting the abduction, adduction, and flexion of the hip joint when you're doing it in this version. But you still want to very much be thinking and conscious that your goal here is to mobilize the femoral head inside the socket of the hip joint. So you want to be thinking about that rotation in the joint as initiating or as the catalyst for doing the actual circle of the leg motion. So the other thing is, when we're talking about mobilization of that moving joint, you want to have control throughout the rest of the body. So you're trying to stabilize the core, activate the core muscles to stabilize the trunk, the spine, the pelvis, and the rib cage, so there's not extraneous movement throughout other areas of the body. You really want to focus on strictly mobilizing that joint. So just keeping that in mind, if I get back into the position, as I open my leg, for example, I wouldn't want my pelvis, right, on the opposite hip to come up, and when I cross over, I'm not going to go excessively into that pelvis coming off the ground. So that position of really staying stable through my pelvis and how it relates to my trunk and spine, wherever my moving leg is in relationship to the trunk and pelvis, I'm very much trying to keep everything else very stable. So I'm going to externally rotate the leg as it opens and thinking a little bit about internal rotation as it closes. So if I were to do that with a TheraBand, because then we can get into some ankle work after, which I'll show you in another video, but it's nice as a variation to use a TheraBand as a prop. Just it gives a different sensation. So technically the TheraBand will assist you on the upward movement of the leg, which is going into hip flexion, but it also gives a little bit different dynamic in the type of stretch that you'll get through the calves and hamstrings as well. So getting back into that position, so if I'm going to use a TheraBand, you want to just be mindful to not allow the shoulders to tense and creep up. Just let the shoulders relax. The arms can be off the ground, but you can certainly let the elbows gently rest on the floor. I always like to exhale when the leg comes up. I have a tendency to go across the body first, and then I'm going to make that same circular direction throughout. And then I would think of exhaling as I go up and inhaling on the down. Now, a couple of other pointers. Be conscious of the down leg. So you don't want that leg, and I'll show you this way, to just kind of flop out and roll and be forgotten about. You want to reach that leg very strong. So I'm thinking about extending the energy of my down leg out through the heel. And I keep the reference point of keeping my kneecap facing the ceiling. That way I'm stabilizing the thigh, the femur, in neutral position in the socket, and I'm staying dorsiflexed on my down leg. So I'm really driving the energy of the leg, as you'll see, out through the heel, but I'm also pushing the leg down, and I'll show you on this side. If I really focus on pushing this leg down into the ground, I'll automatically get more activation isometrically in my quads, hamstrings, and glutes. So I'm thinking about pressing my thigh and my heel into the floor, and that'll lock the stationary, stabilizing leg into the ground, because it is doing just that. It is creating stability. Remember, all of your supine work really is a modified regression for standing work, because you have the ground providing support to the body. And it also takes away the gravitational load and the stability component. But you still want to be mindful that you're thinking about your stabilizing side, your stabilizing leg, so that when you go into the vertical work, your body and your brain, your nervous system already prepared and I've already thought about that connection. So very important to not forget about the non-moving leg. You want as much energy in that leg to stabilize you as you do in the moving leg as you're moving. And just to review again a little bit more what I was referencing about the rotation. So focus on the direction of my thigh and my kneecap. So what I like to think about is a little bit of external rotation as the leg opens out to the side. And then as I cross the body, my midline, I'm consciously trying to internally rotate my leg. So I just like to kind of think about that extra dimension, so to speak, or that dynamic of really getting, right, external rotation on the open, internal rotation on the close. This way, I'm actually getting a little bit more recruitment of the internal and external fibers in the hip complex themselves to initiate. It's like the steering wheel, you turn the wheel to turn the car. The same thing is if it's a hip circle and a hip dominant movement, and that's where the point of origin of movement and mobility is focused, you want to make sure you're very consciously thinking about the rotating muscles in that socket. Just like we talk about the corkscrewing of the arm, it's really those external rotator cuffs in the shoulder girdle that are creating that rotation. You want to think about that same concept when it comes to the hip. Again, they're both ball and socket joints, as I've referenced before. So you want to think if you're doing a rotational movement, please do be conscious of actually actively integrating and engaging your rotating muscles in that joint structure. You'll always have better integrity, and that's going to help you when you do your squats and your deadlifts, because you want to be able to lock into that transverse plane isometric contraction of corkscrew in the hips for more other loaded exercises that you'll be doing standing. So that is the single leg circle in Pilates mat, but it's also just another great example of focusing on just mobility of that one hip joint in that exercise.